like to welcome Jackie and Dan from Worcester onto the stage to talk about the benefit realisation transformation, how the Sunrise EPRs enhance tissue viability management at Worcester Hospitals Trust. Thank you.
Hi, good morning everybody. I'm Anna Bays. I'm the Medical Director at Altera Digital Health. It's great to see you all. I'm introducing Jackie and Dan today, having been involved in this piece of work very closely with Healthcare Innovation Consortium as well. So it was a three-pronged attack from three different areas. But this is a really important piece of work and I'm really excited that it's being shared today. When I first heard that Jackie was keen to do a very targeted piece of work on such a small slither of functionality, such as tissue viability, even though we all know tissue viability has the potential to affect any inpatient and have serious consequences, it seemed to me, surely you're in the middle of an EPR deployment, a phased approach deployment, which the Trust is still rolling out. Surely you want to look a bit wider than tissue viability. But Jackie and the team have turned me around, and I can honestly say it was really refreshing to look at such a focused part of a bigger EPR and the benefits that are associated with that very small piece of functionality, not least because so many of the lessons learnt were not only the benefits of the system and how the system could further be optimised for even more benefits, but also the lessons learnt were so applicable to the adoption of the whole system across the whole of the Trust. So without further ado, I'm going to pass you on to Jackie and Dan from Worcestershire Acute Hospitals, our client, to talk about this piece of work with tissue viability benefits using our Sunrise EPR. Thank you.
Anna, thanks very much. It's a really long title. And I'm not going to apologise for that because I think it does sort of encapsulate some of the work that we've done. Just to move you on really to cover the specifics of this, to deep dive into it. I'm not standing up here as a digital expert at all. I'm a nurse by background of quite a number of years. I'm not going to say how long, but I very much came to the digital agenda because, similarly to when I started in my nursing career, I wanted to see if it's making a difference for patients. And some 5 years ago, actually, I was part of the board that had signed off our EPR business case, which, as many of you will know, they're hard to put together, they're hard to get through because it's really important that we drive forward those efficiencies. But I think for me, one of the areas that I really felt that it was missing was, so what about if I was a patient sitting in one of those beds and I'd got a workforce that were using an EPR? Was it really making a difference to my patient outcomes? And that was the area that I was particularly interested in. And actually thanks to Rachel Fox, because I was chewing her ear, to be honest, in a number of meetings saying, yeah, it's all very well, but actually I've got a team here within Tissue Viability who were saying to me that the way that we'd rolled it out 2 years ago in January 2022 across 58 clinical areas, and the flow sheets for tissue viability were in all of those areas, were not working for our staff. So yes, we were sort of ticking a box, but we were really missing the point. So I was really keen to look at this. I think importantly, it was aligning to the Trust's digital ambitions, and you can see those here. They're no different, I'm sure, to many trusts who are rolling out an EPR. But very importantly for me was number two. But the other stakeholders, obviously, in this were certainly from our finance team, as well as from our data informatics team, were actually how could we really learn more about it. And then actually Claire, who's here, who's our experienced clinical nurse specialist, who's very passionate about tissue viability, said, Jackie, it's just not aligning to the National Strategic Programme, which was actually, if I get moved between different wards, how am I going to receive different care from what patients, what staff are documenting about my care in our EPR? So So looking at the sort of project overview, as I said, really important when I took this forward to get support from it at the board, and thanks to Dan and his clinical expertise with regards to that, actually we really wanted to make sure that we were looking at that preventing, diagnosing and treating. And actually, was the EPR that we had put together, this bespoke EPR, really hitting the mark of what the nurses and our doctors were documenting? So the scope, and I was a little bit challenged because I came to us wanting everything. And of course, you can never get everything. So actually, through the collaboration with Healthcare Innovation Consortium and Altera, we really looked at that being an assessment that covered qualitative benefits. Now, of course, I wanted some quantitative data, and I got a data team who was saying we really want to do that. And I suppose I'm standing here today because we're really at the start of the journey with regards to this. And actually, as we come to the end of the presentation, we'll talk a little bit more about our next steps. We really wanted to see the challenges that our staff would be facing, and actually to make that strategic system in the moment changes to the improvements that we could make for our staff. So with regards to methodology, which I won't cover too much because you're very much, I'm sure, keen on looking at what the outcomes were. It was very much multi-factored approach to our methodology. And thanks again to Health Innovations Consortium, because the skill set from the team that they've got there really helped guide us and actually do some of the work that I know that our clinical teams were really struggling with due to capacity. And that's the one thing that I particularly have learned. It's actually that collaborative approach from different people. And that's quite hard when you're sitting within an acute trust to reach out. But to do that, we looked at survey analysis and interviews. We interviewed, Health Innovation Consortium interviewed 10 staff members. And what was great, and often is a challenge with regards to engagement, is how do you get the consultant from Tissue Viability through to the health care practitioner coming to the table, because actually they're really busy people, and that's one of the hardest bits to get. But because this was something that was very close to people's hearts, and actually we got clinical staff that were really wanting to own it rather than it being digitally owned, we were able to get people there. And therefore, thankfully, through that data collection to analyse from about 56 that were surveyed, staff who came to the table out of about 1,000. So I wanted more, but I was told that was quite a good approach. Through to actually walking the pathway. So having fresh eyes for people to walk that pathway was extremely beneficial. The next slide is a busy slide, and many of you will be familiar with it if you're close to EPRs, but it is that process map. Importantly for us, the blue was where we had Sol, who came alongside Claire from Tissue Viability, who mapped the current pathway for patients, that journey, and thank you. I think that's the important point that you did make. We need to be following some of these patient pathways where EPRs are concerned. At the top, the green were where we knew from a deployment of the EPR we were getting our benefits. And the red is where we could really sweat the assets, and I really like that term. So actually, do we know, with something like Tissue Viability, where we could really sweat the assets and be able to talk with Altera about some of the changes that we could make? I'm going to hand over to Dan, because the important bit of this presentation is what can we do to make a difference, and what did we find?
Looks like some of the it's come across a bit strange on here, so apologise. There's gone a bit. The font's gone a bit weird since moving across, but that's fine. So we really wanted to show some of these benefits then. Absolutely, why are we putting these EPR systems in place? What did we find when we went out with HIC and Altera out to our tissue viability teams, and what were the benefits of those processes? We really highlighted, as you can see by some of the data in front of us, that 52% of the survey respondents found the ability to be able to see that tissue viability referral as one of the most helpful functions. But before, when we're looking at the paper-based systems, you can't always tell at which point in the journey the referral was made, if it was ever made. And that obviously then impacts things like length of stay, of that patient's care, and are they getting the care at the right time. So that was really positive to really see that. We could also see that 60% of the survey respondents said that it was easy to document on the EPR system, and that it was actually having an impact on those administrative tasks. But not just for our clinical staff, but we also found it within our governance teams when they're doing their investigations around, root cause analysis of where these pressure sores or tissue viability cases are coming from. Actually, they were able to go back and really look at that whole journey right there, right then, without having to go and try and dig out all the paper and try and build timelines. It was really easy to see. And actually, we can see then that from a trust point of view, that 96% of the survey respondents found that the trust processes in tissue viability were very effective anyway. So it was looking at how we could take those processes that our tissue viability team had worked so hard to make sure were right for our patients into a digital platform. We found that with the EPR system, certain of the benefits that were coming through were being able to have that automated Waterlow scores, so those scores that were looking at the risks of why people get pressure sores. Actually having it automated means that we took away some of that human element of error, and again helping towards that safety element of looking after our patients, because fundamentally that's what we're all here to do, is make sure that our systems that we implement don't cause any risk to patients, and that they bring that forward. So there's lots and lots of benefits that came forward from there. Obviously, whenever you look at the benefits, we always like to have a little look at the challenges and how we can move those forward. So there was quite a few challenges that were identified. When you're trying to take something from paper, put it digitally, obviously it doesn't always run smoothly, as I'm quite sure very many of you will be fully aware. We were finding actually when we're doing some of the timeline pieces that it was actually increasing some of our ward round times, almost 2.5%, due to the fact that we are currently still working off a hybrid system. So some of our paperwork is still paper and some of it is digital. So people trying to find different bits at different times. As we mentioned before, we're quite digitally naive at the moment as an organisation, and we're looking at how we can optimise all of those pieces to increase. But we kind of expected to see that actually there would be some of these pinch points where things would take longer. As has already been mentioned today, we know that that we're not using our digital platform to its most optimised ability. So from the survey and the work done, we were able to see that actually 40% of the staff said that they weren't actually using that flow sheet to the best of their ability, with actually 42% of staff saying that they had poor confidence in that EPR system as we're building through. So for me, it's, yes, these are all the pinch points that we found within our tissue viability, within trust, but it's how do we take that learning wider than just our organisation as well. So part of my job is working with the ICS for Herefordshire and Worcester, and we're looking at how some of the learning from what we've done here for tissue viability, we can take out to some of our tissue viability programmes out into our wider system, and just making sure that actually the learning that we're doing, we're sharing. And I think that's really important to highlight that, that yes, we know that there's going to be challenges, but actually let's not make the same mistakes when we're looking at it as a system-wide approach and bringing it in into there. So what are we going to learn and how are we going to move that forward? Well, with the help of HIC, we were able to identify some key objectives that we were going to look at, and these were based down into 5 different work streams. We were able to then look at what that successful criteria might look like, and then moving on to those measurable metrics, because we all like metrics. So what this would do is that it will enable us to really look at those areas that we picked up on within the work that we did. And predominantly, a lot of it is around using the EPR and training around the EPR, giving people that ability to play with it without the fear of breaking it, with the ability to play with it, to understand it, to develop it. And our tissue viability team at the acute hospital were really able to play with it, adapt it, change it, work with work with Altera at some of those developments and really push and drive how that can move forward. But that's a model that we can take to multiple different aspects of our EPR system, not just tissue viability, dementia, falls, deteriorating patients, so on and so forth. So what this has done is given us like a bit of a blueprint of what we can move forward in different areas whilst optimising our tissue viability pathways to make sure that the outcome for our patients is the best outcome that we can get for them.
Thanks, Dan. And finally, conclusion, and Anna did challenge me when we started out on this journey, why deep dive? And perhaps why change the methodology that we had, where we'd got quite a large benefits realisation programme attached from our business case to the EPR, but very much deep diving into it, we were able to come up with aspects of benefits realisation that could then be owned by our tissue viability team, enabled by our digital service. But for me, very importantly, 3 key things sang out to it. And you'll see there's the garden analogy there. And no, it's not my garden, unfortunately. I do wish it was. But for me, the key learning of whatever you are doing with regards to benefits realisation, the choice of the approach very much depends on your desired outcome. We've given you an example here for tissue viability. Our environmental factors at that time, very much the priority was to drive tissue viability. I would like to be able to stand here and say, yes, it's reduced the rates of tissue viability in the trust. That's the next stage for us, because actually this is about taking this learning out to our clinical body of teams to own it. And actually the choice and approach here was very qualitative in its approach, but certainly the next is to actually really look at gaining the research questions that are coming out of this so that we can wrap and build our body of evidence for EPRs with patient outcome approach. I think also what's meaningful for the clinical staff, this was very meaningful for them, and therefore we were able to very much gain their input and certainly their commitment. And as I've said, I think we are about to change our approach. We're going to start to deep dive now rather than have this very large body. So going forward for the next financial year, to look at 3 key outcomes that we wish to deep dive, working in collaboration with our partners, and actually then be able to really see at the end of the next financial year, what did we sweat with regards to the assets of the EPR, but also really importantly, how have we driven down pressure ulcer rates, fall rates, etc., because we've got staff who are documenting their pathway and therefore acting on the data that comes out in real time. So thank you very much. I don't know how we've done for time.